Hey, you guys, welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before getting started on our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, 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 you guys. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I'm the founder and CEO of the Nursing Studio. I provide resources, courses, tools, review books, and videos to assist nurses as well as nurse practitioners with boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success, and I would love to work with you as well. Now, I always like to give my disclaimer and the reminder that we know there's no absolutes in medicine, right? We treat on a patient by patient basis, but just to give you that information that all of my questions that I create are designed based on the guidelines that are currently being tested on the AAMP as well as ANCC exam, okay? Now, if I am teaching on any material, telling you about current practice guidelines, I will always say that on the video so there's no confusion because there's some slight variance as far as what is currently being tested on and the things that we do in practice currently, okay? So with that being said, let's get into our questions for today. All right, question number one states a 67-year-old male presents to the office complaining of pain to the right upper quadrant and frequently vomiting. How should the nurse practitioner assess to confirm a diagnosis? Is it A, ask the patient to inhale while pressing under the border of his ribs? B, ask the patient to exhale while pressing under the border of his ribs? C, massage under the patient's rib cage? Or D, nothing at this time, continue to monitor the patient? Take a moment and tell me what you got in the comments. All right, you guys, I always recommend reading the stem of the question first. This causes you to slow down and ensure that you know that what they're asking you, right? Not what you think the storyline is, but what is truly being asked, okay? So take the time to slow down and read that stem first. So this question, stem of the question states, how should the nurse practitioner assess to confirm a diagnosis, right? All right, so we're trying to confirm a potential differential that we are thinking, right? And so, how would we confirm this? All right, all right, all right. So, this person comes in complaining of pain to the right upper quadrant. They're also having frequent vomiting. So, you first need to start thinking in your mind right upper quadrant abdominal pain is typically what? We're thinking like cholecystitis, right? So, what are some assessments that we shall do to confirm that diagnosis? Is your next step that you're thinking. And then how is that completed? So your best answer here is A, ask the patient to inhale, and while inhaling, press under the border of their ribs. And if it produces pain, we know that's a positive finding for what? Murphy's sign, right? All right. So make sure you know the locations on the abdomen. I have a video on that with a chart that kind of gives you the landmarks and the areas that fall in those quadrants of the abdominal cavity. So pay attention to those things, and make sure you know your assessment, the signs, the tests, the maneuvers. Okay. All right, question number two. A patient presents to the office today for follow up. She denies any complaints at this time. She has a history of anemia, alcohol abuse, and hypertension. Lab results shows microcytic normochromic. Folic acid is below therapeutic range, and eosinophils are elevated. Based on these findings, how should the nurse practitioner diagnose? Is it A, iron deficiency anemia, B, folate deficiency anemia, C, B12 deficiency anemia, or D, thalassemia? Take a moment and tell me what you got in the comments. All right, you guys, stem of the question states, based on these findings, how should the nurse practitioner diagnose? When we're trying to diagnose something, we have to run it back and see what assessment findings we have. So the patient comes in for follow-up. She's denying any complaints or issues at this time. She does have a history of anemia, alcohol abuse, and hypertension. So on the assessment, nurse practitioner notes the lab results showing macrocytic normochromic. Folic acid is below therapeutic and eosinophils are elevated. So when we're thinking about this picture of lab findings, it should start to give you a image that a differential pattern you should fall into for diagnoses, right? So macrocytic normochromic, my 2-1-2 rule for anemia. If you don't, go look at the video to help tie these together. But the two larger ones that fall into the macrocytic normochromic range are what? our folate deficiency anemia, and our B12 deficiency anemia. And I always say if something presents similarly, we need to know how to differentiate between the two, right? So remembering that B12 deficiency anemia has the neuro deficits, they may have that beefy red tongue, so they may complain of change of gait, paresthesias, et cetera, right? Um, we know both folate and B12 deficiency can be secondary to alcohol abuse, contributing to these deficits in those, what's the word I'm trying to use, like the vitamin sources in those, with those patients. So she does have a history of alcohol abuse. And here it shows you that the folic acid level is below. So that should have really been your confirmation to go B, folate deficiency anemia. Okay. B12 would have been more so neuro, beefy red tongue. Whereas folate, they don't have that presentation, but their folic acid levels are typically low. Okay. So B, folate deficiency anemia. All right. And question number 3 for today. A patient presents to the office today for follow up. He states that he continues to experience nighttime awakenings at least twice a week and is using his inhaler more frequently. He currently is taking a low dose combo inhalant, budesonide and formoterol PRN. Based on these findings, how should the nurse practitioner treat? Is it A, increase to a medium dose budesonide and formoterol daily? B, increased to a low dose budesonide and formoterol daily. C, add salmeterol. Or D, nothing. Continue the current regimen and monitor the patient. Take a moment and tell me what you got. All right, you guys. So, stem of the question states, based on these findings, how should the nurse practitioner treat, right? So, if we're treating something, we have to run it back and look at the diagnosis and look at the assessment findings, right? So, here we know this patient is already being treated for asthma. They're having the nighttime awakenings, still on the treatment. They are currently taking a combo budesonide and formoterol PRN, but they continue to have nighttime awakenings at least twice a week, as well as using that inhaler more frequently. So we know that means we need to step up, right? You have to step on up the stepwise approach. So if they're continuing to have this even with therapy, you step up to a higher regimen. So next on the GINA guidelines would be B, to increase to a low dose budesonide and formoterol daily, because they're only on it PRN right now. The next highest thing is to put them on a maintenance regimen where they have it every day. Okay. Then, if they continue to have symptoms, the nighttime awakenings, they're symptomatic, the full scale and chart. If you don't, let me know. We can go back over that. But with that, then you would bump up to medium, right? Et cetera, et cetera. Just continue to step up. All right, you guys. So I hope you found this helpful. As always, be sure to like, comment, and subscribe. Um, we have some exciting things coming up. We're finishing another month of our daily practice questions, and y'all are doing amazing. Thank you so much for the emails, feedback, all of the things. It really warms my heart. I just do this to try to assist you guys with your studying, helping you tie it together. And I hope that it is really helpful to you guys. But I really, truly appreciate you and all of the feedback. If you need any of our assistance, our review books, our review courses, links to the ebook and paperback book are in the bio of this channel. So if you need that, just click up there to order that. The ebook, once you order, you have instant access. The paperback book is from Amazon, and shipped to you accordingly. If you have Prime, it's quicker. Our review courses, we have a self-paced course. We do one-on-one sessions. And truthfully, I always say, just give us a call or shoot us an email so that we can figure out what you truly need. Or if you just need help telling you what to work through with what you already have, right? But just give us a call at the nursing studio at 803-400-6864, or shoot us an email at thenursinstudio1@gmail.com. But you know what to do, y'all. Meet me back here. Happy studying. Bye, y'all.